afternoon, and thank you for joining us for this afternoon's virtual media briefing, a special Wednesday afternoon virtual media briefing. About COVID-19 in London and Middlesex County. We're happy to be joined today by the Mayor of London, Mayor Ed Holder, the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie, and the Warden of Middlesex County, Cathy Burghardt-Jesson. Well, welcome to the media in attendance this afternoon as well. We welcome you and invite you to submit your questions for our panel, our guests this afternoon. All you need to do is hover over the middle of the screen and you'll find the question forum. All you need to do is click on that and submit your question, indicating your name, your media outlet, and who your question is for. A welcome this afternoon as well to those of you joining us on Rogers Television, as well as the Rogers Facebook page and YouTube channel, Global News Radio, AM 980 CFPL, and those who are tuning in on the CTV London website. Let's get to our opening remarks, and we start this afternoon with Mayor Ed Holder. Mayor Holder. Mayor Holder, I hate to say this, but your microphone is on mute.
And that was my best comment of the day. Good afternoon, everyone. Thank you, Dan. Once again, we have reason to be cautiously optimistic about where we're going with COVID here in London and Middlesex. And what we've seen recently aren't 1 or 2 day blips. These are consistent and steady downward trends. We're getting back to levels we haven't seen since late November, and the same is true for Ontario as a whole. And that's great to see, and a reminder of how much control we actually maintain, even when one might feel powerless against such an overwhelming threat. Most Londoners are doing the right things. You're making the sacrifices, you're making a difference. We should be reminded of how quickly this can get away from us. It only took a few days and a few outbreaks several weeks ago, and our case counts were doubling, even tripling on a weekly basis. That's how fast it can happen. As we know, and as we've seen, the climb back down to where we are now takes much longer and comes with great sacrifice. So let's take pride in what we've achieved as a city, as a community so far, but also let's not take our focus away from the ultimate objective and the realization that this effort must be continuous rather than intermittent. In the meantime, from a political and public health perspective, our other chief priority is vaccines, namely obtaining vaccines and getting those doses in as many arms as possible, as quickly as possible. Ultimately, the supply of vaccine comes through contracts negotiated by the federal government, and the allocation of the vaccine is directed by Ontario's Ministry of Health. I'm in regular contact with the Premier to ensure London gets its fair share. He understands that, and I'll continue stressing that message directly to the Premier as long as I have to. Having said that, what we have most control over is how fast we administer vaccines once they're received. And in this regard, the Middlesex-London Health Unit has done a tremendous job putting together a mass vaccination plan with the goal of administering up to 3,000 shots per day. London's ready. We just need the vaccine. Over to you, Warden Cathy.
Great. Thanks very much, Mayor Ed. It's great to see you this afternoon. Certainly, the numbers of late have been very encouraging, but I suspect that there will be days when case counts will continue to go up and then go back down. And we have to be prepared for that roller coaster. But during these dreary January pandemic days, I, like the mayor, am cautiously optimistic. But the hard work and efforts by the Middlesex County residents needs to continue. Do not take your foot off the pedal. Tomorrow is the day when a national telecommunications company focuses on the importance of having conversations and discussions about our mental health. You've heard me many times over the last 10 months talk about the need to be keenly aware of not only your mental health, but of the mental health of your family, friends, and neighbors. During the best of times, attention to our mental health is as of much importance as the attention we give to our physical health and habits. But this year, this January, living through the situation that we are, our attention must be heightened. We must watch for those triggers that highlight the stress of how we are living. It is important to make connections that will help to stabilize you or get you through that rocky moment. I am the mother of a son who struggles daily with depression, and I live every day knowing the importance of connection. I also know the stigma of living with a mental health challenge. Mental health illnesses and struggles affect the whole family. It is not the burden that is only carried by one. There is no other health issue that one who suffers from feels judged, alone, unsupported, or believes that suffering in silence is the answer. Just because we are at home does not mean we cannot reach out. I, like everyone else, is getting very tired of the virtual get-together, but thank goodness we do have that. If you do not want to meet someone on a screen for a boost, pick up the phone. Take the time when you are out for your essentials. If you see someone, you can still stop and chat and catch up, of course, doing it safely. The other day, I was picking up some things at my local grocery store, and I ran into an older resident I hadn't seen in quite some time. And while we were loading up our cars, I took the time to chat with him to just ask regular questions. And I didn't think anything of it until a day or so later when I received a voice message thanking me for that chat. A year ago, a chat like that would just happen. We took so much for granted. Even though we are wearing masks, even though we must be physically distant, when we see someone, we can still check in. We will be out of this one day. I do believe that. And I believe that day is not far off in the future. But there will be many lasting effects from this pandemic. And not continuing to address mental health concerns brings me more concern for where we will be when the pandemic is lifted. If we do not keep our awareness top of mind, the burden of mental health will be an even greater problem for our communities than the original pandemic. So tomorrow, if you haven't already, start a conversation with someone you care about, checking in with them and with yourself. And then the key, keep that conversation going. And as always, be physically distant, wash your hands. If you show symptoms of COVID, get tested. Stay home when you are ill. Stay home because that's what we're supposed to do. Mask up, but above all, be kind. Dr. Mackie.
Thank you very much, Madam Warden and Mr. Mayor. So we are indeed moving in the right direction. Lowest case count in some time at the provincial level, 1670. Locally, 39 cases. It's higher than we've seen the last couple of days, but still low enough to pull our 7-day moving average down. Just one death yesterday. On the good news front, we will be completing today all of the vaccinations in high-risk retirement homes, as well as the long-term care homes, which were finished on the weekend. This week, we have vaccinated residents in Inspirit Residences in London, Arbor Trace Alzheimer's Special Care Centre, the Manor Village in London, Queen's Village for Seniors, Fox Hollow Retirement Residence, Highview Residence, and Parkwood Veterans at Parkwood Hospital. Particularly glad we were able to advocate to get support to vaccinate that last group, the veterans who are living essentially in long-term care conditions, but federal funded. So the federal jurisdiction was a little bit different, and just glad to be able to protect the people living there. Those are the good news. We also released, you would have seen our draft plan based on the ministry criteria that was released last week. We were able to turn that plan around in 48 hours. It's a first draft, so we'll receive some feedback from the ministry before finalizing the plan. We've also released that plan for public input and comment as well, so we look forward to hearing people's thoughts there. Of course, I know people will want to say that certain groups deserve to be higher on the priority list. That isn't what we have control over here. Prioritization is happening mainly at the provincial level. The local level would be mostly about how we deliver the vaccine, not to whom. And we look forward to getting people's input there. And of course, having some more information from the perspective of vaccine timing and availability so that we can finalize those plans. That's it for me for now. Dan, happy to help with any questions.
Thank you very much, Dr. Mackie, Madam Warden, and Mr. Mayor. All right. Well, we do have a bunch of questions, and I will begin those right now. Steve Young at CTV London and News Talk 1290 CJBK has a few questions. So let's start. This one, Dr. Mackie, is for you. Where do staff and prisoners attending Elgin Middlesex Detention Center fall within the vaccine priority list? And should the facility ban visitors to reduce the likelihood of transmitting COVID-19 into the jail?
Yeah, so the province has defined 3 phases of vaccination. The first phase is really for high-risk individuals in long-term care retirement homes, Indigenous people, as well as high-risk healthcare providers. Second phase, there is some additional flexibility, and I think it's fair to say that we're weeks away from knowing exactly who is in the second phase. We have a broader, definition of eligibility that includes people in congregate settings, high-risk environments, but we don't have things like exactly which facilities nailed down yet. So one thing that we're hoping, as we see this virus spread through some of those congregate living environments, is that there's a bit of flexibility around deploying the vaccine where there is an outbreak. Certainly that's been a priority for the homes that we've gone into. I've tried as much as possible to prioritize first those homes where there was an ongoing outbreak. And if we're able to use the vaccine in that way, that will really help address some of those outbreak-related issues.
Thank you very much, Dr. Mackie. Let's go to another question from Steve Young. Dr. Mackie, and you mentioned, I think we mentioned off the top, the publication of the vaccination plan on the health website. Steve is asking, Dr. Mackie, have the locations of the 3 additional mass vaccination clinics been confirmed? If so, where will they be located?
At the moment, those locations haven't been confirmed yet. We will have at least one site in the county of Middlesex, as well as more than one site in the city of London. And as soon as we have those locations confirmed, we'll let you know. There are at least a dozen locations that have been under consideration, and it's now a matter of fine-tuning which are the most appropriate.
Thank you, Dr. Mackie. We also have another question from Steve Young, and it has to do with people who live in the rural communities in Middlesex County. Dr. Mackie, how will people in rural communities with limited transportation options be provided the vaccination?
Yeah, it's a great question. The limited transportation options make it a challenge with this vaccine, which really has limitations logistically. It's not a vaccine that can easily be sent out, to all family doctors or pharmacies. The vaccine requires a very high level of cold chain, so you've got to have ultra low temperature freezers to keep the vaccine preserved in order for it to remain viable. That really limits how we can distribute the vaccine. And so at this point, we don't have a great option for widely distributing in many locations. And that will be something that we work on over the next while. And, transportation, when that's a barrier, we also have various solutions we can put in place specifically around transporting the people, even if we can't transport the vaccine itself.
Thank you, Dr. Mackie. And Madam Warden, since we have you on the call today, I'm wondering if you had a comment you'd like to add.
Yes, thanks for that, Dan. I just want to assure the residents of the county that the municipalities across the county will work hand in hand with the health unit to look at creative ways to work with some creative transportation solutions if we have to get people to different vaccine clinics. Already you can hear some service club options, that sort of thing. And of course, working with the Middlesex-London paramedic services will be, they'll be a key partner in all of this. So lots of voices at the table, but we'll make sure that we're a cooperative partner in this.
Thank you, Madam Warden. And Dr. Mackie, just a final follow-up from Steve Young. And Steve, I know you got some other questions. We'll get to those a little bit later. But it does relate to the mass vaccination question before Dr. Mackie. And Steve would like to ask, when do you anticipate opening the next mass vaccination clinic?
Yeah, we don't have a date for opening the next clinic yet. It really depends on the availability of the vaccine. At this point, we're not we don't have a predicted date at which we would receive enough vaccine to justify a second clinic.
Thank you very much, Dr. Mackie. Let's move on to a couple of questions from Jennifer Beeman, who is joining us, of course, from the London Free Press. Jennifer Beeman asks, Dr. Mackie, does the health unit have results from the variant testing done on samples from EMDC, Men's Mission, Country Terrace, and Middlesex Terrace? And if yes, what were the results?
Yeah, I'm afraid we don't have those results yet. The whole provincial system for testing for variants of concern is really just in its infancy, just really being developed now. So there is still quite a turnaround time on getting those results.
Thank you. And a follow-up from Jen Beeman, Dr. Mackie. Does the health unit have an understanding of why the ongoing outbreaks at Middlesex Terrace and Country Terrace have been so deadly and widespread at those facilities?
Yeah, it's not difficult to identify the issues there. You've really got, at Middlesex Terrace and Country Terrace, both facilities have significant infrastructure issues with shared rooms and in some cases shared washrooms between multiple residents. And so that means that even with the best intentions and the best infection prevention and control practices, it's very difficult to stem the spread once it is in one of those older facilities with shared spaces.
Thank you. And another question from Dr. Mackie before we move on. Dr. Mackie, are residents of Parkwood's Veterans Care Unit receiving the COVID-19 vaccine? And do we know how many residents are getting the doses?
Yeah, thanks for the question, Jennifer. Vaccinating, the issue with the Parkwood veterans, first of all, yes, we're in there today vaccinating all of the 112 or so residents that are living at the facility now. Because it's a federally funded facility, it doesn't fit within the Ministry of Long-Term Care. And so it didn't fit within the ministry approved direction, although the alignment is obviously very good. So we were able to get support right from General Hillier and Alison Blair, who are the two provincial leaders on this vaccine campaign, and able to get in there today to vaccinate all of the staff. Sorry, all of the residents.
Thank you very much. Let's go to some questions from Kate Dubinsky at CBC London. Dr. Mackie, this first one is for you. Locally, we're moving in the right direction, but the EMDC seems to be moving in the wrong direction. How worried are you about this outbreak, and how is the health unit working with the institution to curb this outbreak? Do you know more about how this outbreak is spreading within the Elgin Middlesex Detention Center?
Yeah, EMDC, the Elgin Middlesex Detention Center, is another example of a facility with challenging infrastructure. You've got close quarters, you've got limited space, and you've got, in normal times, a lot of contact between the inmates in that facility. And so we are working closely. They have, at the best of times, an overburdened healthcare staff, working our best to support the healthcare staff and the guard staff at the facility. The upside to the EMDC outbreak is that both the staff and the inmates tend to be relatively young, and so they tend to be at relatively low risk. That said, among the inmates, there is a relatively high level of other unrelated diseases that could put inmates at risk. So fortunately, we haven't seen fatalities there. Hopefully we won't because of the protective age factor. But certainly it is a place where it will be difficult to get a hold of that outbreak.
Thank you, Dr. Mackie. And Mayor Holder, Kate Dubinsky is asking, what do you, Mr. Mayor, have to say about the EMDC outbreak? What are your thoughts about that?
Well, hi, Kate. I would share the same concerns as expressed by the Medical Officer of Health with respect to the widespread in the EMDC. I think that is absolutely a concern. And I think some of the causes are self-evident in terms of close proximity and just the general groupings of the population. I'm confident as we go forward, and particularly as vaccines become available, that in due course they will also be accommodated. But it's a challenge, and part of the challenge, as per my earlier comment, is the issue around the supply of vaccine. And so I think, listen, they they deserve to be taken care of and appropriately responded to like any group. And I think there is some higher risk. That's evident in the numbers that we're seeing in terms of spread. And that's why I hope and pray that the vaccine comes sooner than later, so that we're going to be able to take care of both the guards, the inmates at EMDC, and certainly all of those in London and in Middlesex where we can be able to provide the shot.
Thank you very much, Mayor Holder and Dr. Mackie. Okay, folks who are joining in with the media, this is your warning that we're getting down to the end of the questions. So if you have been waiting for your opportunity, that opportunity is now. We've only got a couple of questions left. So click on the send for the questions if you want to get those in. All right, let's go to a question, Dr. Mackie. This one is for you from Matthew Trevithick at Global News Radio, AM 980 CFPL. Dr. Mackie, can you speak to the current status of voluntary testing of inmates at EMDC? How many have been tested, and is the health unit anticipating any additional cases?
Well, so as of yesterday, we had 11 positives among staff, 19 among inmates. Yes, as we continue to test, we do continue to see more cases, and we expect to continue to do so. I don't have a total number of inmates who have been tested there. It really is about close contact. Have they been in the same space for a prolonged period as one of the positive cases? So again, testing continues. We expect cases to continue to increase there.
Thank you, Dr. Mackie. Let's go to Jennifer Beeman has a couple of other questions. I think you may have answered the first one. Do you have an update on the number of cases among staff and inmates? Dr. Mackie, I can say that there were 2 additional staff cases. So we have 19 among inmates and 13 among staff. That is the most recent update, and I know you haven't had a chance to see that yet. Let's go to another question from Matthew Trevithick. Dr. Mackie, with the dashboard being updated, what information can you share about the 39 cases reported today?
Yeah, so the dashboard, thanks for the question, Matthew. We are transitioning to the provincial IT system, which means that the dashboard won't be live for the next couple of days. Hopefully by Friday, we have all of that sorted out, and you can go back to that as a primary source. So we did have 39 cases yesterday. We did have 1 fatality that was associated with the Middlesex Terrace, a resident there. In terms of additional cases, Dan mentioned the 2 staff cases at EMDC since our update as of yesterday. No new outbreaks, no resolved outbreaks, and we did have, there was another case associated with Men's Mission. That facility has really gone above and beyond in partnership with the city to find alternative accommodations for the people residing there. So we're hoping that tapers off over the coming days.
Thank you, Dr. Mackie, and thank you for the question, Matthew. And again, I'd also like to say a big thank you to everyone who's tuning in today, and the patience that we're asking you to have for us as we transition the dashboard. We know a lot of people are using that as a source of information every day, and we are doing our best to bring all of that information back on Friday as we transition the back end of that system, the database that we draw from, to provide that information to you. So thank you very much. Let's move to another question, and this, Dr. Mackie, is for you from Jennifer Beeman. Has the health unit issued any orders to care homes with ongoing outbreaks?
At this point, we haven't issued any orders to care homes with outbreaks. Again, the issues there largely being related to the facilities. And so very unfortunate to see the spread so quickly, but staff there and residents are doing everything they can to try and prevent it.
All right, let's go to a question again from Kate Dubinsky at CBC London. Dr. Mackie, the EMDC outbreak started with staff. Did it spread from staff to inmates, or did an inmate bring it in and spread it to other inmates?
You're right, Kate. The first cases identified were among staff. I think it was the first 4 or 5 cases identified were among staff. That's the most information we'll have to be able to make that determination. It's not entirely clear whether it was obtained from staff primarily or from inmates. At this point, it seems like it may have come in through staff first, but there may have also been an undetected case among an inmate that sparked that. So can't say for sure at this point.
All right, and a follow-up question to you, Dr. Mackie, from Kate Dubinsky. The Solicitor General's office tells us that inmates are provided, sorry, I'm just reading the question, Kate. Oh, I think you mean masks. Okay, the Solicitor General's office tells us that masks are provided to inmates, quote, if required, usually when they're under droplet precautions because they've tested positive. Dr. Mackie, do you think inmates should be required to wear masks all the time?
So, I mean, the question of masking in those environments, really, it should be about places where distancing isn't possible. The same as we have for employment environments where you're unable to keep 2 meters. Masking should be the rule, and that's obviously got a lot of implications in a corrections environment. But if masks are deployed in that way, that can help stop the spread.
Thank you, Dr. Mackie. And our final question, there are a couple that just came in. And yes, Kate clarified provided masks. Thank you, Kate. I'm glad I got that right. A final question here from Jennifer Beeman. Dr. Mackie, do you know how many cases are linked to men's mission?
Yes. Just give me a moment. I'll pull that up.
And Mayor Holder, did you have a comment while Dr. Mackie is looking for the numbers?
While he's looking at that, I was going to actually respond at the end, but I think it's an opportunity, and I intended to make this in my opening comments. You know, we haven't, for the last number of certainly days and perhaps a few weeks, reminded people that we have an app that people can, should, and frankly, I think strongly urge everyone to sign up to, so that we can support our contact tracing. And I would highly encourage listeners to use the app, because it makes the job of the health unit, and certainly we as a city have provided staff to support the tracing component, and it just makes not only life a lot easier, but at the same time it brings I think it brings a level of confidence to the process if people will use the app that allows us to follow when people come in proximity to someone who has been diagnosed with COVID.
Thank you very much, Mr. Mayor. And Dr. Mackie, we're going to come back to you there quickly.
Yeah, Jen, I can't pull it at the moment, but we'll get back to you by email later today, okay, on the men's mission cases.
Yeah, Jen, I will. I'll follow up with you, Jennifer. That does bring us to the end of our questions. Just going to take a quick look again. Yes, that does bring us to the end of the questions. Thank you very much, Dr. Mackie, Mayor Holder, and Madam Warden Burghardt-Jesson, for your time this afternoon, for sharing your thoughts and information with all of us. We will be back to our regular schedule next week, so we will have our next virtual media briefing on Monday afternoon at 2 o'clock. And then, of course, next Thursday, we'll be back as we normally do. In between now and next Monday, have a great rest of today, have a great weekend, and we will see you on Monday. So long for now.